I really try to work on building up my clients' inner beauty as much as their outer. I can make you look great. We can correct what we need to correct, but I really try to empower them, empowering women, empowering the men that come through our door. I love it when our guys come through the door because they need advice. They want to talk, and just empowering them. And a lot of times it's just not just with their skincare routine, but it's just about life in general. So I think if you feel good about yourself internally and you're happy, then that's going to glow and that your exterior is going to look just 10 times better because of that.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Okay.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Lisa Evans, the owner and lead esthetician of Radiance Beauty Lab. With over a decade of experience in the skincare, plastic surgery, and dermatology industry, Lisa combines her expertise in aesthetics with a deep understanding of the latest trends and techniques. She is dedicated to providing personalized skincare solutions that enhance natural beauty and promote long-term skin health. Outside of her professional life, Lisa enjoys spending time with her family, exploring the latest beauty innovations, and constantly refining her skills to stay at the forefront of the ever-evolving aesthetics field. So Lisa, welcome and glad to have you here.
Thank you, Daniel. It's nice to be here. I appreciate it.
Yeah, so let's start off with this, Lisa. How did you first get interested in the medical field?
Oh, okay. So I was in a corporate world for 15 years, but ever since I was little, I just always loved everything beauty, hair, makeup, nail polish, nails, dressing up, performing. So I was in corporate, but one of my best friends had a cousin from California, and she was a nurse, and she actually was an injector and came to Michigan and introduced me to the world of aesthetics. And I was absolutely hooked right away. So never thought I'd leave that corporate world.
Mhm.
But as I started to get to know this gal and she had her own business and we talked, and I was like, I just want to do what you do one day. Um, I started really thinking about it. And my boys, I have two boys and they were young at the time. And I thought, you know what? Now is the time to kind of jump ship and get into this whole new atmosphere. So that's basically what I did.
Got it. And what caused you to decide to start your own practice? Why not just work somewhere else?
Well, I did. Okay. So once I got out of corporate and being in that for 15 years, I started working, for this gal, and she really taught me a lot, right? And so I basically started working with her, and then I got into the derm world and worked for a dermatologist and was opening a huge, almost 8,000 square foot business for him.
Wow.
And then I started getting into working for a plastic surgeon. And I just got to the point where I was building successful businesses for everybody and working really hard and not necessarily reaping the benefits of that, but building a great clientele and a great business. And so I thought, you know what? I think I can do this on my own. I think I would have a following. So I kind of just did it on a whim, to be honest with you.
And the rest, as they say, is history.
The rest is history. Yep. And so I did. And it was a challenge, don't get me wrong. And I doubted myself a million times, but I'm really glad that I stuck with it and I'm here where I'm at today. So,
Okay. Now, I want to dive a little bit deeper into the treatments that you provide in your practice. One
mhm.
specifically I want to go over is the microneedling with exosomes. So
Yes.
I want to dive a little bit more into exosomes because I think not a lot of people may have heard of what exosomes are. So can you talk
Mhm.
about what exosomes are and why specifically you see a benefit when you pair it with microneedling?
Okay. So, we've had growth factor on the market for quite a while. And, coming from various portions of the body, right? But they've really perfected it over the years. And Mayo Clinic has worked on it for years. It's been into the industry for a long time, the medical industry. And so, as exosomes have gotten very popular, we have seen a huge, huge change in our skin over the last 2 years. We've all on our team have been using exosomes, and they just make a big difference. They're going to continue to grow collagen better. They're going to help with elasticity. the overall glow and tone and texture, but they're proteins, right? So they're proteins that are communicating with our proteins, and they're basically saying to mimic youthful proteins. So in turn, when you're doing that with microneedling and getting into the skin, you're getting into that dermal layer. So you're just feeding that the proteins, and so that communication with our skin just overall kind of thrusts that result from regular needling into another level.
So you're basically turning back the clock on your age of the skin.
Yes, absolutely.
Mm,
So, I have people come in all the time, ask me what I do, and I'm an open book, and I tell them that is the biggest thing that's been tripping out of my mouth for the last 2 years is exosomes. Get on exosomes. If you're over the age of 35,
mhm,
get on exosomes. It
mm.
is going to reverse aging by those communications in the cells. So.
Wow. Okay. So, and when you talk specifically about reversing aging, is it something where it is really more of just giving your skin kind of more of that shine? Is it getting rid of wrinkles? Is it fixing certain like blemishes? Like, what exactly does it do? I guess in what situations would you really want to use it?
So I think, you can really work on everything, right? Because you can partner exosomes with microneedling, you can partner them with lasers, you can partner them with injectables. So it's working on everything. It's actually because that communication system is happening in those proteins and those molecules, um, that information is changing everything. It's changing fine lines and wrinkles. It is really turning back that clock because if you're adding it to anything that's corrective, again, adding those exosomes in, it's just going to help with fine lines and wrinkles, tone and texture, pore size, pigmentation, and overall just the glow and health of your skin. So you can add it to anything you want as far as a procedure, and it's going to make that the best result you could possibly get, if
Okay.
that makes sense.
Got it. Yeah. Okay. So then when it comes to this, how many treatments does someone typically need to get the full effect out of it? And do you start seeing results after the first session, or kind of what is the expectation when it comes to this treatment?
So our office is really into corrective treatments, right? We're not really a med spa that you're going to come in and just get that foo-foo treatment. So we want to really correct. And I always tell people there's never a one and done treatment. So if somebody tells you that, they're lying to you. Correction takes time. We have damaged our skin from UVA, UVB, environmental factors, our lifestyle, everything over the years. So if someone's coming into me at 40 years old or 50 years old and has lines and wrinkles and pigment and all kinds of things, I'm going to tell them, listen, you're going to probably be with me 6 months to a year because skincare is absolutely like weight loss, right? You want to lose 20 pounds, you got to diet and exercise and get there. And it might take 6 or 8 months. And then when you get there, you have to maintain it, right? So you can't go back to eating like crap. You're going to stay on that, schedule and maintain that. Skincare is the same thing. So I say, if you're coming in and getting microneedling with me, it's all going to be dependent upon the quality of their skin. If their skin barrier is really, damaged, if they are lacking quality of everything in their skin, they're not on good skincare, they haven't had a treatment, they're just starting, that might take longer, that might take more procedures. But I always tell people you're going to have to at least have 4 microneedling treatments to really get to that corrective level. I need injury repair. I need an injury repair, injury repair. We don't want to take a long time in between those treatments either because we're starting over again. So I want them on a specific regimen with me with microneedling. I want them on a specific regimen with me with RF microneedling, Fraxel, BBL, anything. So I really try to say, listen, 6 months to a year, you're going to see me probably every month. We're going to do these treatments. We're going to correct everything that you're concerned with. And then after that, I want you to focus on a quarterly basis with me, doing something like microneedling or BBL or resurfacing.
Okay. So in the beginning, every month, and then once they've largely gotten the results, to maintain it would be about every 3 months or so.
Yes, yes, yep. And
Okay.
again, just depending on, again, the quality of their skin and where they're at in their whole lifestyle.
Okay. Now, you mentioned a couple other different modalities, but I want to dive a little bit deeper into the microneedling versus the RF microneedling, because it's
Yes.
easy to miss the difference between those. It's the RF part of it. But really, what's the difference between the two? I mean, they're both microneedling, so what's it between regular microneedling and RF microneedling?
So our regular microneedling is say like a pen, right? It's motorized. It has so many RPMs per second. It's going in and out of that skin. Um, you know, doing the treatment and you're using that by your hand. But RF microneedling is typically a modal, it's a machine, right?
Mm,
But RF microneedling is going to bring heat in with very precise microneedling. And depending on the RF machine, it's going to be a lot deeper, probably, depending on part of the body that we're using. So it can go a lot deeper and penetrate into the skin a lot deeper. And with that heat, you're going to get that contraction and that tightening of the skin because we're getting into that dermal layer, that SMAS layer. So microneedling is amazing. I tell everybody, every age group, every skin color is pretty safe and effective for everyone to do regular microneedling. And it's tried and true, and it gives results. My RF microneedling is quite the jump up though, because of that heat, because of that intensity, and because, with that, we can contour the face. We can, you know, decrease some fat in areas. We can really work around specific menu of services with RF microneedling too, depending on what the client needs. So there is a big difference with that because of that heat portion coming into it and also the depth penetration with RF
okay.
microneedling.
Now, you mentioned that the depth penetration, that's a big difference between the two. Just because something is going deeper, does that necessarily mean it's better, or is it just going to be for a different condition that, okay, for this condition, you need to go deeper. For this other condition, it's fine to go a little bit more shallow?
Yeah, so with regular microneedling, you're typically going anywhere from a zero point 0.5 millimeter to 1.5. If someone really has a lot of pitted acne scars, thicker skin, you might go deeper than that, right? But you don't want to damage the skin. There's no real need to go very deep in the skin when you're doing regular microneedling. Just to, if it's anti-aging, we're not talking scars or stretch marks or something, but regular microneedling, you don't have to go, you're going into that epidermis and that dermal to stimulate that collagen growth and get that elasticity.
Mhm.
With RF microneedling, again, you don't want to go super deep in that because you don't want to melt fat. You don't want to damage what's underneath that, the fibroblasts and everything. You don't want to damage it and go too deep. You want to understand exactly where to be in the skin layer and depth, so you can really work on remodeling and then getting that collagen elasticity and tightness and glow and shrinking, fine lines and wrinkles. So the depth, again, I wouldn't say going super deep on the face is always a no. But if you're going into the body, we're working on arms, we're working on abdomens, knees that have excess fat, subcutaneous fat that we really need to get rid of. I'm going to go deep and I'm going to go probably pretty hot because I know that portion of the body and that area and that subcutaneous fat can take it. But again, just understanding the person, the body, and how much extra subcutaneous fat they have is going to be how I determine my depth.
Got it. Okay. Now, I want to slightly shift tracks and talk about combination treatment. And I think already the microneedling with exosomes is considered combination treatment.
Yes.
But could you talk about why it's important to consider combination treatments versus just someone coming in, oh, I just want Botox, I just want filler? Why is combination treatment typically much more effective?
I think combo treatments have gotten really effective over the last few years, especially, but combo treatments can be amazing and again get someone to the next level. And I get ragged on a lot in my office. My girls always tell me that it looks like my office is exploded when people come in, but it's because I am always combining things. If somebody comes in and wants um, a BBL, I might suggest doing a BBL and then maybe doing a Frax over that because of the fact that I want to get the discoloration, but I also want to resurface their skin. Combination is going to take you to the next level. Whether it's even a facial and adding a chemical peel or doing a facial and then microneedling, facials are going to clean that skin, get that entire surface free of any bacteria. And then going in and doing a healthy microneedling is just, again, going to give you a better result. It's going to help you heal better. And it's just going to be better for your skin and just the overall, I guess, condition of it.
Okay. So how does someone know if a combination treatment would really benefit them or not? Does it just kind of start off with what their goals are and then kind of determining, hey, based on what your goals are, based on your current skin condition, you
Yeah.
benefit from this, this, and this?
I don't think they know, to be truthful.
Mm,
In my practice, I have most of my clients are like, you're the expert. What can you tell me? And
mm,
so it's a lot of me educating them or us educating them and saying, listen, you should add a chemical peel after this because um, just the other night actually last night I did a BBL face, neck, and chest, and I was like, let's put a VIPL over that,
mm,
which I was a chemical peel trainer for over 10 years. I probably didn't mention that to you, but I was a chemical peel trainer, so I love chemical peels. They're amazing to me. But I did this BBL, and I knew this client. I knew she could handle this double treatment, so I put a VI peel over her because I really wanted to produce some new skin cells, get rid of some pigmentation, some lines and wrinkles, and I just knew those together were going to be great. So I'm always trying to combine, and I do it on a daily basis.
okay. Now,
But combining those treatments are going to, again, just take that person to the next level. So I don't want people to be scared of it, but you have to go to the right provider.
mm,
You have to go. That's very important because I wouldn't just do a double treatment on someone that walks right through my door for the first time. If
yeah,
they tell me they want it, even I'm going to educate them on why they should start on something different or whatever. But for someone an experienced esthetician, absolutely should be double procedures all the time.
okay. Now, I want to go into some of the common myths and misconceptions you hear most often from your clients. What would you say are some of those most common misconceptions you hear?
I mean, I think a lot of clients come in and hear things on TikTok,
Mhm. Mhm.
about products, about procedures, the beef tallow thing, all this kind of stuff are misconceptions. I think people just see these influencers all the time and they really think that what they're saying is golden. So it's frustrating to us because we're trying to debunk those misconceptions. So I think that is probably what I see the most and what I'm constantly trying to fight against is, listen, why are you putting beef tallow on your face? To me, it's crazy. There's all the studies doesn't there's no health benefit, skin benefit. I mean, yes, it's occlusive. It'll keep some moisture locked in, but use some Aquaphor, So those types of things are the things that I feel like are a biggest challenge.
Got it. Now, you did bring this up before as far as people should be going to the right provider to make sure that they are
Mhm.
getting the right treatments. So, let's say someone is looking to get some type of treatment done. They don't know anybody. They're looking for a provider that has experience, has the knowledge, and get them the results they're looking for. What piece of advice would you give to that person as they're doing their search, looking for that good provider?
First of all, I always say if you see someone, a friend or a coworker, that their skin looks amazing, ask them where they go. What do they do? Because a lot of times, your business is based on my business personally is based off of referrals, and I get that a lot.
Mhm.
But I would say if you're really trying to search out somewhere good and reputable, do a Google search, top med spas in the area, or just Google search it and look at their website, check out their website, see what they look like, see if they have before and after pictures and how well they're welcoming their website is. Can you book online? How many questions are they answering? What treatments do they do? What's their knowledge? Do they have a medical director listed? Those types of things. So I think that pretty much is, either asking somebody or just doing a search. I think you can really tell by what you're seeing and also the reviews on Google, but then calling and that first line of customer service is going to tell you a lot too when you call that office. If they're knowledgeable, if they've been around for a while, if they're here to help you, those types of things are what I would say look out for.
Got it. Okay. Now, I'm talking about your approach, how you approach your client care. How important do you think it is to have an artistic eye in what you do?
I mean, I think it's very important to have an artistic eye. I think in the injection world, you have to have an injection eye. The my injector is very artistic. She looks at everything in that view, but I'm the same way. So I think it's artistic, but I also think it's educational. It's more education because artistic, I guess I could say that. Oh, that's a good question. I guess I could say that yes, you have to be artistic, but I feel like for me, it's more knowledgeable, it's more education, it's more understanding what I'm looking at.
Mhm.
and what's going on in their life and what are they using and what's their lifestyle like. And I'm totally picking them apart, more so than I guess artistic wise. But artistic wise, I will help them. And I always suggest, injections or how we can help their brows or their balance of their face. I'm really in tune with that too. So I do talk a lot about that. But for me, my job is almost like I would say more of a doctor where I'm looking at that as how I'm going to repair this person, how I'm going to make them happy, how I'm going to correct them, what's the best attack with this client. And that's kind of where my mind goes.
Okay. And on a separate topic, creativity. I think you consider yourself pretty creative with all the combinations and trying different things.
Right.
But how important do you think creativity is in what you do? Because I think when people think about medicine, creativity is probably not the word that comes to mind right away. But how important
Yeah.
the creativity part is?
I think it's huge. I mean, you have to have a creative mind because again, you're on your toes every day. I'm seeing, 10 people a day. So it's 9, 10, 11, 12, 1, and it's all day long. And I'm shifting gears all the time. So I think creativity comes with what procedures are the best for them. They come in, they want one thing, and I'm very well known to be like, you know what? I don't think your skin needs that. I think we're going to change and we're going to do this today. And my clients trust me because I'm constantly creating a menu of services in my mind of what I want to do to this person to get them to that end result.
Mm.
So I think it's very important that someone has that creativity and thinks that way.
Okay. Now, I do want to shift gears a little bit. I'm sure that throughout your experience, Lisa, you've had some challenging cases or at least memorable cases. Is there maybe one story that you can share of one of those memorable cases that you've had and how you were able to get them a great outcome in the end?
Yeah, so I had this one gal, young gal, come in, and she had been going to a local esthetician for years, and she had been in and out of derms and doctors. And she came in, and she was talking to me about acne, and she had pretty bad acne on her face, but that actually wasn't even her concern. Her concern was when she took off her shirt, she was just scattered with cystic acne, but very, very deep pocking scars,
Mm,
redness everywhere. I was actually shocked. That was probably the worst case I've ever seen.
mm,
Um, and so at first, I mean, at first I told myself internally, I'm like, what am I going to do here?
mm,
This is going to be a challenge. Can I
mm,
get this person? Can I help this person? And
mm,
she was desperate. She's like, Lisa, I've been to derms, I've been to esthetician. There, no one can help me.
mm,
So I basically looked at it from a medical standpoint and I really got to know her and what her lifestyle's like and how she lives her day to day. But I started really thinking about what the best procedures would be for her. And so, again, my creativity was kicking in, and I knew I'd have to have chemical peels and lasers and RF microneedling. And I kind of went to town. She trusted me, and I said, I want you in here every single month.
mm,
I'm going to beat the hell out of you. You're not going to like me sometimes, but you're going to love me in the end. And I do tell that to people. There's some ugly things we might have to go through, but you have to trust me
mm,
and I will get you through this. I will walk you through it by, I'll hold your hand. I'll tell you every expectation you need to have. Some of it's going to be painful, but so she was really just all in it with me. And I first really concentrated on getting her cystic acne under control, understanding how she's her dietary, lifestyle and things. And she had been on medicines before and she had been on other things, but nothing was really helping her. So we really worked at cleaning up her diet a little bit, and then we also worked at getting her the proper skincare and a routine in for her day and night, her AM and PM. And then I went at it. I RF microneedled her, I Morpheused her a few times. I did very strong TCA peels, and I had a BBL her, for her discoloration and we got her about, I would say about 80% better. And this girl was a girl that came in defeated
mm,
and she never showed her back and she was in tears. Her family has thanked me. She's written a huge recommendation for us and she's got on Google and she comes in the summertime and she has her, little tank tops on and
mm,
local restaurant, and she's like, Lisa, I've never been so confident in my life. I feel like I can wear dresses and bathing suits. And she's telling me all these, vacations she's been on. And she just said, you just changed my life. And, that was something I just knew. I'm very competitive. I always have been, and I just wanted to compete with myself and be like, I can prove to myself and her, to get her where she has that confidence internally and externally. And to see her feeling as great as she has just been the reward of what I do every day.
Yeah, I think that's an amazing story you tell because when people think about the aesthetics industry, I think a lot the people who don't know think it's all about vanity. But it's not.
Yeah.
It's about getting people's confidence back. It's about in many situations like just getting people to feel normal. Like
Yes.
they
Yes.
just want to feel normal. And I think that's the
Well,
piece missing.
yeah, it's kind of funny you say that because, one day I was just talking to a client and I said, I always, I don't know, maybe I self-doubt myself or whatever, but I was telling her, I'm like, well, I'm an esthetician. It's not like it's a huge deal. And she said, Lisa, do you understand what a big deal it is? Because when people come in and they don't feel beautiful about themselves or they have a scar that's been, something that has, been bothering them for 10 or 20 years or their whole life, and you correct that and you change that, you change people's lives. People that are depressed and possibly thinking that there's, no other way, and you correct something and make them feel beautiful. She's like, that's a big deal. And and that from that day forward, I just started thinking, that you're right. That is why I do it. And that it's such a good feeling, but that is really truly why I do what I do.
Yeah, and I can see why. Like you are changing people's lives with it. So
Yes, thanks.
now with Lisa, where do you think the future of aesthetics is going?
The million-dollar question. I think it's going to be just a more natural approach, using our own, I know you've heard this before, our own PRP, our own platelets, and doing things that really help to produce the collagen elasticity, and getting into growth factors, exosomes, PRP, PRF. That is all the rage right now, and I don't see that stopping at all. I think that you're going to see people backing away from that filler look,
Mhm.
that overfilled look, that Hollywood look that they had. And, I talk about the Kris Jenner look right now. She's had a deep plane facelift, but they really softened her look. And I think that's what it is. You want that softened, natural, rejuvenated look. You want people to look at you and say, wow, I cannot believe you're 54 years old. What are you doing? You want people to think how great you look, but not look at you and go, whoa, she's got, her cheeks are filled and her lips are filled. So it's just going to be more of a natural approach,
Mhm.
and just have that, again, your body, people are getting healthier. They're getting wiser. They're getting smarter. They want to know, they're getting into peptides. They're getting into all kinds of things. So we want to use our own bodies to stimulate production. And so if we can use our own blood and our own platelets to do that, we're going to jump on that and do that. If we're going to use, biostimulators, things like that, we're going to choose that. But I do see that people are really wanting that more natural look right now.
Mhm. Okay. And with that future in mind, what is your vision for your practice, Radiance Beauty Lab?
It's to just kind of keep doing what we're doing. I mean, I think that we're into corrective, right? So we are using everything that we're talking about. We're using, the microneedling, the RF microneedling, the exosomes, the PRP, the PRF. We're doing all of that already, and we're going to continue to do that. We're doing a lot of Sculptra. We're doing a lot of diluted radiesse. Again, just, feathering and fanning that into injections to kind of help mimic, get the bone growth and the collagen growth. And I think we're just going to really plow through this year, and that's going to be the focus, is just growing what we currently have. We don't constantly have to be what's new, what's exciting, what's this, what's that. Let's get everything in here. Be the expert in what we are in, and just take that to the next level. So we already are focusing on inner beauty as well as external beauty, and I think this is an exciting time in our industry because I think people are really jumping on board this natural healthier look.
Yeah.
And it excites me because I like that.
Yeah, I agree. I see the same thing. That's where people are going in. Even the practice is starting to see that people looking for that more natural look.
Yes, yes. It looks better, right?
Yeah, it does. It definitely does. Okay. Well, Lisa, I have one last question for you, but before I ask it, I do want to point people to your website at radiancebeautylab.com.
That's
Now,
correct.
Last question is, what does beauty mean to you?
Oh, that's a big question. I think beauty is, there's a lot of things that beauty means to me, but really I think it's more internally. Yes, everybody likes to look good and we want to, get compliments and feel good about our outer beauty. But I think if inner beauty isn't there, you're never going to be happy on the outside, right? So I really try to work on building up my clients' inner beauty as much as their outer. I can make you look great. We can correct what we need to correct, but I really try to empower them, empowering women, empowering the men that come through our door. I love it when our guys come through the door because they need advice. They want to talk, and just empowering them. And a lot of times it's just not just with their skincare routine, but it's just about life in general. So I think if you feel good about yourself internally and you're happy, then that's going to glow and that your exterior is going to look just 10 times better because of that.
So, well, there you have it. Lisa sharing her expertise. So, Lisa, where
Thank
can
you.
people contact you in your practice?
I'm sorry.
Where can people contact you in your practice?
Oh, yeah. So they can get on the website, like you mentioned, at radiancebeautylab.com. They can call us at 734-358-6100. They can go online, they can book online. So those are easy options. We do Facebook, we do Instagram. You can message us through there because we, contact people through there as well.
Okay. Well, Lisa, this is great. Thank you for coming on. Thank you for sharing your knowledge.
Thank you very much. Appreciate it.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.